Gel injections for the knee are a potential treatment for arthritis pain, but there are several pros and several downsides to these injections that you should understand as a patient. Hi, my name is Dr. Marc Gruner, and I'm a board-certified sports medicine physician. What are gel injections? Gel injections are called hyaluronic acid injections. They are treatment used to help reduce knee pain from osteoarthritis. Osteoarthritis happens when the cartilage in your knee slowly wears down over time. This leads to pain, stiffness, and a feeling that your knee is not moving smoothly. The injection contains a thick, gel-like substance called the hyaluronic acid. This is actually something your body already makes. It is found in the fluid inside your joints and helps your knees move smoothly. When arthritis develops, this fluid becomes thinner and less effective. The goal of a gel injection is simple. It is meant to improve the quality of that joint fluid, reduce friction, and make movement less painful. A helpful way to think about this is like a squeaky door hinge. When you add oil, the hinge moves more smoothly. In the same way, gel injections try to improve how the knee joint glides. When the gel coats and joint surfaces, it can help absorb shock and reduce irritation inside the knee. It may also have anti-inflammatory effect, which can further reduce pain. Gel injections in the knee are done in the doctor's office. A needle is placed directly into the knee joint. Some patients get a single injection, while others receive a series of 3 injections over a few weeks. Now let's talk about the potential benefits as well as the downsides of these injections. One of the main benefits is pain relief. Some patients notice improvement within a few weeks, with the best results often showing up to around 6 to 12 weeks after the injection. For some people, this relief can last several months. Another benefit is that gel injections are generally safer than long-term use of oral pain medications like ibuprofen. These medications can affect the stomach, the kidneys, and the heart when used over time, especially in older adults. Gel injections may also last longer than steroid injections in some cases. Steroid injections tend to work quickly but wear off faster. Gel injections can take longer and provide more sustained relief. For certain patients, these injections may help delay the need for a knee replacement surgery. This can be important for people who are not ready for surgery or want to avoid it as long as possible. Another advantage of this treatment, it can be repeated. If a patient responds well, doctors may recommend another round of injections in the future. Usually, insurance covers it every 6 months. The downsides of gel injections are important to understand before deciding if it's right for you. One of the biggest concerns is that depending on the severity of the arthritis, the gel injections might not be as effective. This means that not everyone will feel a noticeable difference. Some patients feel meaningful relief while others feel little to no change. There are also side effects to consider. The most common ones and usually include swelling, pain, or stiffness in the knee after the injection. These usually go away within a few days. Gel injections tend to work best in patients with mild to moderate arthritis, so the severity matters. These are the patients who have some cartilage left in the joint. In more advanced arthritis, where the cartilage is mostly gone and it's bone rubbing on bone, the injections are less effective. In these cases, other treatments may be more appropriate. Patient factors also matter. Weight, activity level, and overall joint health affect how well the treatment works. Gel injections are one option in a larger treatment plan for knee pain. Other treatments include physical therapy, weight loss, strengthening exercises, anti-inflammatory medications, and sometimes steroid injections. In more severe cases, surgery such as a knee replacement may be needed. The best treatment plan usually involves a combination of these approaches, rather than relying on just one. There's pros and cons, and the right decision depends on the individual patient. If you are someone with mild to moderate knee arthritis who wants to avoid surgery and reduce reliance on medications, gel injections may be worth considering. But if you are expecting dramatic pain relief, it is important to set realistic expectations. The improvement is often modest, and it does not work for everyone. Have a discussion with your doctor about specific situations is key. Factors like your age, activity level, and severity of arthritis all play a role in whether this treatment makes sense for you. It is also important to know about other treatments for knee pain. Another type of injection you may hear about is PRP, or platelet-rich plasma. This uses your own blood processed to concentrate healing factors called platelets, and these are injected into the knee. PRP is thought to work differently than gel injections. Instead of just improving the lubrication, it may help reduce the inflammation and promote healing at a biological level. The evidence for PRP is very strong, and in recent studies, the combination of PRP and gel injections can provide longer lasting relief than gel injections alone, especially in certain patients. If you are interested in PRP, there's another video on the channel that breaks it down in detail, including who it's best for, how it compares to other treatments, and what to realistically expect. What questions do you have? Drop them in the comments below, and I'll do my best to answer them in a future video. Remember to hit the like and subscribe, and we'll see you in the next one.